Comprehensive NCLEX-RN Challenge Exam 4. Question 1. When giving intravenous, IV, phenytoin, which of the following methods should you use? Use an inline filter. Withhold other anticonvulsants. Mix the drug with saline solution only. Flush the IV catheter with dextrose solution. Phenytoin is highly unstable and will precipitate if mixed with any solution other than 0.9% normal saline. Question 2. After surgical repair of a hip, which of the following positions is best for the patient's legs and hips? Abduction, adduction, prone, subluxated. Abduction, moving the legs away from the midline, prevents the femoral head from dislocating from the newly repaired acetabulum. Question 3. Which of the following factors should be the primary focus of nursing management in a patient with acute pancreatitis? Nutrition management, fluid and electrolyte balance, management of hypoglycemia, pain control. Pain in acute pancreatitis is often excruciating and is a primary focus of management, although fluid resuscitation is also a high priority. Question 4. After a liver biopsy, place the patient in which of the following positions? Left side lying, with the bed flat. Right side lying, with the bed flat. Left side lying, with the bed in semi-Fowler's position. Right side lying, with the bed in semi-Fowler's position. The patient is placed on the right side to allow the weight of the liver to provide pressure on the biopsy site, which helps prevent hemorrhage. Question 5. Which of the following potentially serious complications could occur with therapy for hypothyroidism? Acute hemolytic reaction, angina or cardiac arrhythmia, retinopathy, thrombocytopenia. Thyroid hormone replacement increases the metabolic rate and oxygen demand on the heart, which can precipitate angina or arrhythmias in susceptible patients. Question 6. Adequate fluid replacement and vasopressin replacement are objectives of therapy for which of the following disease processes? Diabetes mellitus, diabetes insipidus, diabetic ketoacidosis, syndrome of inappropriate antidiuretic hormone secretion, SIAD. Diabetes insipidus is caused by a deficiency in ADH, vasopressin. Therapy focuses on replacing fluid and the missing hormone. Question 7. Patients with type 1 diabetes mellitus may require which of the following changes to their daily routine during periods of infection? No changes. Less insulin, more insulin, oral diabetic agents. Infection increases the body's metabolic demand and stress levels, typically leading to increased blood glucose and a need for more insulin. Question 8. On a follow-up visit after having a vaginal hysterectomy, a 32-year-old patient has a decreased hematocrit level. Which of the following complications does this suggest? Hematoma, hypovolemia, infection, pulmonary embolus, PE. A drop in hematocrit post-surgery often suggests internal bleeding, such as a vaginal or pelvic hematoma. Question 9. A patient has partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Albumin, D5W, lactate Ringer's solution, 0.9% sodium chloride solution with potassium. Lactate Ringer's is the preferred isotonic solution for initial burn resuscitation as it most closely resembles the electrolyte composition of plasma. Question 10. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Thoroughly irrigate the wound before collecting the specimen. Use a sterile swab and wipe the crusty area around the outside of the wound. Gently roll a sterile swab from the center of the wound outward to collect drainage. Use a sterile swab to collect drainage from the dressing. Collecting the specimen from the center of the wound using a rolling motion ensures that fresh exudate is captured rather than surface contaminants. Question 11. A nurse is administering 4-furosemide to a patient admitted with congestive heart failure. After the infusion, Which of the following symptoms is not expected? Increased urinary output, decreased edema, decreased pain, decreased blood pressure. Furosemide is a diuretic intended to reduce fluid volume. It is not an analgesic and is not expected to directly decrease pain. Question 12. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Gender, age, obesity, heredity. Obesity is a lifestyle factor that can be modified through diet and exercise, unlike age, gender, or heredity. Question 13. Tissue plasminogen activator, TPA, is considered for a patient with myocardial infarction. Which of the following is a contraindication for treatment with TPA? Worsening chest pain, history of cerebral hemorrhage, history of prior myocardial infarction, hypertension. A history of cerebral hemorrhage is a major contraindication for thrombolytics, TPA, due to the extreme risk of a new intracranial bleed. Question 14. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises. Which of the following choices reflects the purpose of exercise for this patient? Increases fitness and prevents future heart attacks, prevents bed sores, prevents DVT, deep vein thrombosis, prevent constipations. Immobility post-ME increases the risk of venous stasis. Leg exercises promote venous return and prevent DVT. Question 15. A patient with myocardial infarction progresses to cardiogenic shock. Which of the following symptoms should the nurse expect? Hypertension, bradycardia, bounding pulse, confusion. Cardiogenic shock leads to decreased cardiac output and poor brain perfusion, resulting in restlessness, anxiety, or confusion. Question 16. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? Ask the patient to lie down on the exam table. Draw blood for chemistry panel and ABG. Send the patient for a chest X-ray. Check blood pressure. The first step in assessment for a patient in distress is checking vital signs to determine the severity of the hemodynamic status. Question 17. A clinic patient prescribed nitroglycerin for angina calls complaining of frequent headaches. Which of the following responses is correct? Stop taking the nitroglycerin. Go to the emergency department. Headaches are a frequent side effect because it causes vasodilation. The headaches are unlikely to be related. Nitroglycerin causes systemic vasodilation, which frequently results in headaches. This is a common and expected side effect. Question 18. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which of the following explanations would account for her symptoms? The symptoms may be the result of anemia caused by chemotherapy. The patient may be immunosuppressed. The patient may be depressed. The patient may be dehydrated. Chemotherapy can cause long-term bone marrow suppression and anemia, which manifests as fatigue and brain fog or difficulty concentrating. Question 19. A clinic patient has a hemoglobin concentration of 10.8 g/dl and reports a strict vegetarian diet. Which nutritional advice is appropriate? The diet is providing adequate sources of iron. The patient should add meat to her diet. The patient should use iron cookware and eat dark green leafy vegetables. A cup of coffee should be added to every meal. Vegetarians can maintain iron levels by using iron cookware and consuming non-heme iron sources like legumes and leafy greens. Question 20. A patient is receiving packed red blood cells, PRBCs, for severe anemia. Which of the following is the most accurate statement? Transfusion reaction is most likely after the infusion is completed. PRBCs are best infused through a 20 G/4 catheter. PRBCs should be flushed with a 5% dextrose solution. A nurse should remain in the room during the first 15 minutes of infusion. Most hemolytic reactions occur within the first 50 ml of the infusion, therefore, close monitoring in the first 15 minutes is vital. Question 21. A patient who has received chemotherapy is given an injection of epoetin. Which of the following should reflect the findings in a CBC several days later? An increase in neutrophil count, an increase in hematocrit, an increase in platelet count, an increase in serum iron. Epoetin alpha stimulates the production of red blood cells, which is reflected as an increase in hematocrit and hemoglobin. Question 22. A patient is admitted with suspected polycythemia vera. Which of the following symptoms is consistent with the diagnosis? Weight loss, increased clotting time, hypertension, headaches. In polycythemia vera, the blood becomes hyperviscous, thick, which frequently causes headaches, dizziness, and visual disturbances. Question 23. A nurse is caring for a patient with a platelet count of 20,000/microliter. Which of the following is an important intervention? Observe for evidence of spontaneous bleeding. Limit visitors to family only. Give aspirin in case of headaches. Impose immune precautions. A platelet count below 20,000 puts the patient at high risk for spontaneous, life-threatening bleeding. Question 24. A nurse assesses a patient who has been taking long-term corticosteroids. Which of the following is a typical side effect? Select all that apply. Hypertension, Cushingoid features, hyponatremia, low serum albumin. Long-term corticosteroid use leads to Cushingoid features, such as a moon face, buffalo hump, and central obesity. Question 25. Which of the following is the most important nursing action when caring for a neutropenic patient? Change the disposable mask immediately after use. Change gloves immediately after use. Minimize patient contact. Minimize conversation with the patient. Strict hand hygiene and changing gloves are the most critical actions to prevent the transmission of pathogens to an immunocompromised patient. Question 26. A nurse teaches family members about infectious precautions for a leukemia patient. Which statement indicates the family needs more education? We will bring in books and magazines. We will bring in personal care items. We will bring in fresh flowers to brighten the room. We will bring in family pictures. Fresh flowers and plants are prohibited for neutropenic patients because they can harbor mold and bacteria, example Pseudomonas. Question 27. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which of the following is the most likely age range of the patient? 3 to 10 years, 25 to 35 years, 45 to 55 years, over 60 years. ALL is the most common type of leukemia in children, with the peak incidence occurring between ages 3 and 10. Question 28. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which of the following symptoms is typical of Hodgkin's disease? Painful cervical lymph nodes, night sweats and fatigue, nausea and vomiting, weight gain. Hodgkin's disease often presents with B symptoms, which include drenching night sweats, fever, fatigue, and unexplained weight loss. Question 29. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find in a lymph node biopsy? Lymphoblastic cells, Reed-Sternberg cells, Gaucher's cells, Reeder's cells. The presence of Reed-Sternberg cells, large, multinucleated cells, is the definitive diagnostic marker for Hodgkin's disease. Question 30. A patient is about to undergo bone marrow aspiration and biopsy and expresses fear. Which of the following is the most effective nursing response? Warn the patient to stay very still. Encourage the family to stay in the room. Stay with the patient and focus on slow, deep breathing. Delay the procedure. Staying with the patient and providing distraction or relaxation techniques, like deep breathing, is the most effective way to manage procedural anxiety.